Good evening, everyone. Welcome back to our another session of our Wednesday webinar by Beatinghurst. I'm Dr. Betty Tay, the founder and the CEO of Beatinghurst. And we have here with us, anyway, sorry for the delay. We had a lot of technical glitch. And we have here for the first time Dr. Azaini, who is actually a forensic pathologist. And he's going to speak on a very interesting topic, which I know nothing about, forensic anthropology. So because we are late, so we shouldn't delay any further. Maybe Dr. Azani can introduce himself, and then we go ahead with it while I try to share screen.
All right. Thank you. Thank you.
Okay. Is this okay? Okay. Can you see? Can you see? Can you hear me?
Can I start?
Yeah, can you?
Yeah,
Yeah, you
yeah,
can start.
yeah. I can hear you. All right. Thank you very much, Betty, for the introduction. Assalamualaikum and good evening. I apologize profusely for the delay. It was entirely on my side.
No,
Yeah, so
don't
I'll try
worry
to keep
about
this
it.
very short. Yeah. My name is Mohd Azaini bin Ibrahim. I'm a forensic pathologist with the National Institute of Forensic Medicine in Kuala Lumpur. I'm a forensic pathologist, but with more than a passing interest in forensic anthropology. Now, forensic pathology, I'm sure most of you know, most of you are familiar with what a forensic pathologist does, yeah. But probably forensic anthropology, probably something quite mm, uh, new, yeah. I would so on that note, uh, I will start this talk, yeah, uh, on forensic anthropology. Uh, may I have the next slide, please? Okay, forensic anthropology means what is forensic anthropology? Yeah, definition of it is it's applying the science of physical anthropology or human osteology in a legal setting. Yeah, most often in criminal cases where the victim's remains are skeletonized. Uh, a forensic anthropologist assists in identification of deceased individuals whose remains are badly decomposed or mutilated, burnt, or unrecognizable. So what we're trying to do is try to determine who this person was, who the deceased was, yeah. And in our work, we tend to work with forensic pathologists, forensic odontologists, homicide investigators as well, to try to identify a body, yeah, and then try to detect whether the body, whether there is trauma on the body, and try also among our jobs is try to determine how long that person has been dead, yeah. And of course, as what forensic pathologists do, we also go to court and testify as an expert witness. Next slide, please.
Hold on now. No, I can't. Okay.
All right. So what we try to do when we are faced with when we are given skeletal material, when the police brings in a dead body into the mortuary, what we try to do is one try to determine age, sex, ancestry, uh, living height, yeah, how high, how tall that person was before he passed on, whether there was presence of trauma and what caused this trauma, yeah, and then the manner of death as well, and the post-mortem interval. Post-mortem interval means the time between death and this discovery of the body, yeah. Uh, Also we try to as best as you can as we if we are called to the scene, we try to locate and help the police locate and recover buried or surface remains, yeah. Murderers, they tend to, I mean, perpetrators of crime, they tend to bury bodies, yeah. So what we do is we try to retrieve these bodies uh, as best as we can so that evidence is preserved, yeah. And when we're talking about sex and age and ancestry and the living height of someone, it is what in anthropological terms is called the biological profile. Yeah. So once we have this biological profile of the deceased, uh, we will submit this. We will give this information to the police, and they will try to match this profile with persons who are reported missing. Yeah, in a certain daerah or in certain area. Yeah. All right. Next slide. Next slide, please. So, in a nutshell, forensic anthropology is, I mean, anthropology itself is a study of uh, all biological and cultural aspects of all humans in all places in all times. So the word anthro itself means humans. Yeah. So in a nutshell, forensic anthropology is a combination of biological anthropology, which is a study of human bones, osteology as well, with mixed with some idea of forensic science, yeah, because you can't run away from forensic science when you're doing forensic, either forensic pathology or forensic anthropology. So you have biological anthropology with forensic science, and you get the feel of forensic anthropology. Next slide, please.
Hold on, huh?
And as I mentioned in my earlier slide, we do, as forensic anthropologists, we do work apart from forensic pathologists and forensic odontologists. We work with forensic archaeologists as well. And usually in Western countries, especially, these two go hand in hand. Yeah, forensic archaeologists are specialists who use archaeological methods to locate and retrieve human skeletal materials. Archaeologists, basically, I'm trying to say they're archaeologists. Yeah, forensic pathologists, they are dentists, yeah, actually dental surgeons who specialize in identifying persons from the dentition. And of course, we do work with other experts as well, ballistics experts, forensic entomologists. Forensic entomologists are experts in the study of bugs, to put it in layman's term, yeah. Flies and all sorts of creepy crawlies, yeah. So they are experts in that, and forensic botanists among others as well. Next slide. The traditional role of the forensic anthropologist has always been examination of the dead in order to determine.
Bring
Uh,
the remote.
Pardon?
Oh, sorry.
In,
Uh,
yeah, all right, okay.
okay.
In order to determine, first of all, the biological profile, the identity, and the cause of death, and so forth. Yeah, that's what the bulk of my job is doing that. Yeah, but now, if you look at the world now, many forensic anthropologists are involved even when soft tissue is still present, when the bones, when the body is not fully skeletalized. So for instance, when you have a mass disaster, yeah, the downing of an aeroplane, for instance, or an earthquake, yeah, where the victims, the event is quite recent, the bodies have not yet skeletalized, but the numbers is great that you need to identify the dead. Yeah. So mass disasters, airplane crashes, wars, atrocities committed during warfare. These are instances where there's a great number of bodies, and these bodies need to be identified. That's where a lot of forensic anthropologists work now. Yeah, and some of them are also doing things like more of historical, more of interest in, for instance, trying to reconstruct the face of King Tutankhamun, for instance, yeah, or the last Tsar of Russia. These are more of historical interest, yeah. But the majority of forensic anthropologists work in areas of uh, mass disasters and genocide and crimes against humanity, where mass graves are present. Yeah. Next slide, please. Now, so as a forensic pathologist, uh, the picture on the left, this is the more, I mean, this is more what I'm more used to seeing. Yeah, a fully fleshed body, but showing signs of decomposition. Yeah, albeit this is still early post-mortem decomposition, where you can see, the skin is still intact. There's a bit of marbling. You see those black lines on the chest. Those are signs of early decomposition. I would put this around 2 days old, yeah, maybe 1.5 to 2 days old, yeah, the time since death. But as a forensic anthropologist, the photo on the right is the one the kind of remains that I work with, yeah, fully skeletalized, yeah, uh,
Okay, I'm going to
sometimes
change
and many
slide. Yeah,
times, yeah, pardon?
I'm going to change slide because worry that the
All
gore.
right, okay, no problem. All right, so uh, So, yeah, as a forensic anthropologist, I'm called to duty when human remains are found at archaeological digs or when badly decomposed or burnt skeletal remains are discovered. Yeah. So, and when I'm given the case, when the police brings a case to my mortuary, I try to derive to get as much information as I can uh, from examination of the body. Yeah, and in my mind, uh, I go through these questions that you see on the screen. Yeah, the first question that I'm going to ask myself is, are the remains bone? uh, a layman or even a police officer, they may not be very familiar with um, what a human bone looks like. Anything that is remotely uh, similar to a bone, for instance, a dried twig, a branch of a tree that's small enough, maybe it happens to take on the shape of a bone. It may look like a bone to them. Yeah. So my first job is to determine is this item a bone or not? Yeah. So that's the first question that I ask myself. The second question is that, and if it is determined to be a bone, are they human or non-human? Yeah. And then the third question I ask myself, are the remains of medical legal significance? I will get back to that question later. I will get that to what medical legal significance, what it means. Yeah. I'll do that later, in a later slide. And the fourth question I ask myself is, now, the bones I'm looking at, do they belong to a single individual or are they the commingled remains of several individuals? Yeah. Next slide, please. The fifth question, the fifth, sixth, seven, and eight, as I mentioned before, these are what we call the biological profile. By determining the age, the sex, the ancestry, and the stature, I'm trying to build up an identifier, yeah, something that can be used to provide an positive identification to the body, yeah. And then item number 9, I try to determine the time of death, and I look for any anatomical anomalies, whether there is any disease manifestation on the bones, injuries, and other characteristics to provide a positive identification to the body, yeah. And of course, well, if you look at number 11 and 12, cause and manner of death, most forensic anthropologists, me included, I try not to comment on that because I leave it to the forensic pathologist to that. Because given the cause of death is still the domain of the forensic pathologist. Yeah. So I will give my opinion on how that person died, but at the end of it, in the report, only the forensic pathologist is able to write down the cause of death. Yeah. Next slide, please. So back to question number 1. Yeah, the protocol, the list that I gave you just now. Number 1, are these bones or not? To a layman, they will look like bones, but to us, being medically trained as medical students, we've seen this before. The picture on the left shows a model skeleton. Yeah, the one that medical students use in them when they're studying anatomy. Yeah, so but to a layman, it might appear to be real bones. Yeah. So sometimes you get cases like this. Yeah, I've got one case personally where bones, medical students, plastic bones were mistaken for a real human bone. Yeah, and sometimes the photo on the right, at least on my right, shows some stones. Yeah, that they may resemble bones of the feet and hands. Yeah, uh, so for a layman, they might think it's a bone. Yeah. Next slide, please.
Okay.
Yeah, and then the next question is whether the bones are human or not. Yeah, because if the bones are determined to be non-human, so it's not a police case anymore. The police will just close the case and nothing happens. Yeah. But so my job is to determine whether the bones I'm saying are they human or non-human. A human skull is unmistakable. Yeah, it's nobody can mistake a human skull for any other no other living being skull looks like human skull. Yeah, the skull on the right is one that belongs to a coyote. Yeah, a wolf type canine. Yeah, so it's the skull is not a problem. Yeah, but when looking at other bones, next slide please. Now when you're looking at other bones, this may cause a problem. Yeah, the photos on the left shows the human pelvis, yeah, and the photo on the right, it's a pelvis, but it's not human. It belongs to a cat, yeah.
Oh,
So only someone who's trained in looking at bones can is able to tell the difference, yeah. Again, the picture on the left, the bottom picture on the left shows a human hand, yeah, but the picture on the right is a hand, is the forehand of the American brown bear. Yeah. So in hunting season in United States, hunters see this often, and they would think that it is the bones of a human being. Yeah. So so you can understand that to a non-medically trained person, this might to them is human bones. Yeah, so it might be mistaken for human bones, and this bones will be brought to the police station, and the police they will lodge a report saying that they're from blah 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 bones here and there, and the police will bring it to the mortuary. Yeah, so my job is to determine whether these bones are human or not. Next slide, please. Now, the term medico-legal significance, what does it imply? It implies that whether the have the has a disease is the disease dead long enough for an investigation to be open. Yeah, uh, what we call in legal terms as a statute of limitations. Yeah, for murder there is no statute of limitations. That means once if the perpetrator is not found, the case is still open regardless of whether someone dies 100 years ago. Yeah, so that is what is called medical legal significance. Let's say if a bone is found and it's deemed to be of really really old bone. For instance, if you look at the photo in on the top left corner where you see an archaeologist peering down into a grave, uh, so those bones, even from the outside, you know that they look ancient. Yeah, they look old. These are archaeological bones. Yeah, so they are not medical legally significant anymore. They are historically significant. They are archaeologically significant, but they are not medical legally significant. Yeah, because they past the period of uh, uh, the statute of limitation. Yeah, the bottom right photo shows me many years ago uh, when uh, when I don't know whether any of you are from Malacca, but in 2017 they were they were renovating, at least redoing the area around Kota Melaka, and they found the Jabatan Warisan found some bones. Yeah, uh, uh, when they were digging the area. Yeah, they called me. I went into the area. Yes, they were bones. As you can see, my hands, the brush, I'm brushing off some dust from the part of the skull. Yeah, but because of so together with the Jabatan Warisan, we concluded that these bones again were of historical significance. Yeah, they're not recent. Uh, because of the areas, the artifacts that were found nearby suggested that remains were there since the time of the Dutch occupation, which was in
oh,
1641 onwards, if I'm not mistaken. Yeah. So, so again, it's not medico-legally significant anymore, but it is of historical interest. Yeah. Next slide, please. Again, looking at this, the left upper photo, you can see mummified remains, yeah, uh, placed in a grave, flexed in certain position together with some items, yeah. This is uh, what the civilization of that time used to do, yeah. So looking at it, you know these are really, really old remains. The way they are buried is what do you call it? Typical of the burial practices of that civilization. Yeah, and the photo on the right is just how an old bone looks like compared to a fresh bone. Yeah, you can see that the old bones tend to be very light and very dry. Yeah, with a lot of holes, what we call porosity, especially over the ends of the bones. Yeah, they tend to lose that greasiness of that wetness look to them, and then they're very fragile. Yeah, they're very brittle. So these are what really, really old bones would look like. Yeah. Next slide. So question number 4 that I need to answer is whether the bones that I'm looking at, which was brought to me in the mortuary, whether they belong to a single individual or they are commingled. Commingled means there are more than one individual. There's more than one individual in that collection. Yeah. Looking at this photo alone, those red stars, those red shows that there are at least 3 tibia. Yeah. So that indicates at least 2 people. Yeah. So that's my job to determine whether, because the more people, the more individuals there are in a bone collection, the chance of that death being more than just a natural death or accidental death increases. Yeah. It could even be a homicide. Yeah. So the finding of more than one body is always not a good sign. Yeah. All right. Next slide, please. Okay, now we go to the I would say the big 4, which is determining the biological profile, because this 4 will help identify uh, a body. Yeah, we'll start with sexing first. Yeah, how to determine whether uh, the remains are of a female or a male. Yeah, now 2 bones stand out. Yeah, when we are trying to determine whether the sex. Yeah, the pelvis and the skull. Yeah, and in experienced hands, the pelvis can give a 95 to 100% certainty that the disease is either male or female. Yeah, because the female the female pelvis is made is developed such that they are able to bear and expel children. Yeah, babies. Yeah, so they're made for to be able to contain a baby for 9 months, and then in order for the baby to pass through the vaginal canal. So there's special adaptations have been made to the pelvis, and then we use that to differentiate the female pelvis from a male pelvis. Yeah. For instance, if you look at the first photo, top and bottom, the subpubic angle, what we call subpubic angle, it's wider in female, it's more than 90 degrees, and it's narrow in the male. Yeah, it's less than 90 degrees. Yeah, and then again for the male pelvis in the second row, the sacrum is tilted forward. So if you imagine that area, that white area in the pelvic inlet, you imagine that as a Mickey Mouse. I always tell my students, imagine that as a Mickey Mouse face, the 2 ears and the face, compared to a female pelvis where that image is less seen. Yeah, so it's more obvious in the male. Yeah, uh, and then of course the uh, the the third photo shows how uh, the ilium bones are spread out in females and more closed. Yeah, in males. These are just 3 of the 6 or 7 traits that you can see on the pelvis that helps us determine whether the pelvis belongs to a male or a female. Next slide, please. The skull, as I mentioned, also has certain traits that can help determine whether uh, uh, that can help determine the sex of the deceased. Yeah. Uh, Generally, the male skull or the male bone, in general terms, is larger than the female. Yeah, they tend to be more rugged. Yeah, a lot of uneven surfaces, yeah, very rough, yeah, they give that kind of the impression, yeah, the male skull. The mastoid process tends to be larger. The mandible also, the body of the mandible tends to be larger and more robust. Yeah, uh, everything else about the male skull is the area in front of the eyes is more pronounced. Yeah, the bones in front of the eyes above the eye orbits are more pronounced, what we call supraorbital ridges. So these are things that we look for when trying to determine whether the bones belong to a male or a female. Next slide, please. Again, some of the points which I mentioned just now. Yeah, uh, supraorbital ridges, the glabella. Yeah, the glabella is the bone in between in between your eyebrows. Yeah, that part is called the glabella. So it's more pronounced in the male. Yeah, the mastoid process is larger in the male. The nuchal area on the back of the head is more pronounced in the male. The forehead, yeah, the forehead is more slanting in the male as compared to the female, where it's more straight. Yeah, so all these things that we look for, yeah, to determine sex of the skeletal remains. Yeah. Next slide, please. Now, so that is for sexing, yeah, trying to determine the sex. Now, the other thing we try to determine is ancestral group, yeah, whether or not the skeleton belongs to an Asian race, yeah, or Asian ancestral group, or to the black ancestral group or white. Yeah, so large. Uh, so generally, um, the ancestral groups are divided into three large groups. Yeah, whites, blacks, and Asians. Yeah. Now, whites and blacks, they will have what I would term as the two extremes. Yeah. For instance, we are looking now at a skeleton of a white person, yeah, a white male, for instance, yeah. Now the red arrows shows the 5 points that I look at, try to determine whether the skull belongs to a white person or black or an Asian. The arrow at the top is what we call the nasal root. The one below it, the bridge of the nose. The third one is the aperture, the shape of the nasal aperture. And the one on the left, the fourth one is the anterior nasal spine, and of course the lower border and also the lower border of the nasal aperture. Now, in a white person, the nasal root is very high as well as the nasal ridge, and they've got a very narrow nasal aperture. And uh, the anterior nasal spine is also it's very prominent. Yeah. Next slide, please. And compared to a black skull, which you see on your left, where the nasal aperture, especially if you look at the nasal aperture, is more rounded. Yeah, it doesn't have that very narrow triangular shape of a white person. Yeah, and then it's got very low root and a very low bridge of the nose, compared to again an Asian male skull, where for an Asian male the features are more in between, yeah, between a black skull and a white skull. Yeah. Next slide, please. So ancestry is important because we need to determine the ancestry first. It helps a lot if we know the population we're working in. For instance, if I'm doing a case here in Malaysia, I'm primarily interested in whether the skull or the human remains, they could be either Asian or white, because most of us, Malays, Chinese, Indonesians, Filipinos, Vietnamese, yeah, we belong in the Asian ancestral group. We come from the same ancestral stock, yeah. But Indians and Sikhs, Punjabis, yeah, they have the skeletal makeup of a white skeletal ancestral group. So for me, working here in Malaysia, the ancestral groups which I'm interested in when I'm faced with determining the ancestry is whether they belong in the Asian group or the white group. Yeah. So it's important to know the population you're working in, because by knowing that, it helps you to determine. It makes it easier to determine the other biological profiles. Yeah. Next slide, please. Now, the third thing I try to determine is the age of that person when he or she died. Yeah. Now, and there are different methods used when I'm dealing with a certain with different age groups. Yeah. For instance, if I'm looking at a very young child, I'm examining the remains of a very young child of, let's say, from a baby up until the age of 11 or 12. I look primarily at the teeth. Yeah. Because the ages, I'm sure some of us have kids and nieces, nephews, and uh, the teeth drop off and appear at certain fixed times. Yeah. So we use that to our advantage, that we use that to try to determine the age of that child. Yeah. But when you're looking at someone who's older, for a teenager, for instance, yeah, an adolescent from the age of 12 to 20, you use another method. You don't look at the teeth anymore. Yeah. And when you're looking at an adult, whether it's a young adult or middle adult or an older adult, then you use a few other methods. So it really depends on the material you're faced with, yeah, the material you're examining. Next slide, please. Now, as I mentioned before, in young children, we look at dental eruption patterns. Yeah, for instance, we know that the first molar, the first molar appears at around the age of 6 years old. The second molar appears at the age of 12, and in between the ages, the premolars and the incisors will start to appear, and the milk teeth will start to drop off, and things like that. So we know that pattern, and from that pattern, which is well charted in books and in dental books and everywhere else, we can tell the age of the child. Yeah. Now, in sub-adults or in adolescents, we look at what we call the stages of epiphyseal closure. You see, the ends of our bones when they're forming, they're made up of two types, of two bones meeting together and fusing. Yeah, the diaphysis, which is the central shaft, and the epiphysis, which are the ends of the bones. Yeah, and they fuse at a certain age. For instance, the lower ends of the humerus, and the upper ends of the tibia, of the ulna and the radius, they will start fusing at around the age of 14 until 18 years old. Yeah. So when you get remains that show very clear lines of fusion, like the arrow show pointing there, uh, let's say in those particular joints, then you know that you're examining a child or an adolescent around the age of 14 to 18 years old. Yeah. And same thing goes for the femur, the lower femur and the upper tibia. Again, they
Sorry, you're lagging. Yeah.
bone that shows fusion, then you can determine the age of that child, that youth, adolescent, that sub-adult.
Okay.
Sub-adult,
Sorry,
now
you're
when
lagging
for
a little.
adults, you have different methods. I'm lagging.
Yeah, just now you were lagging. Now you're fine. Now you're
Okay,
gone.
now I'm fine. All right, okay. All
Okay.
right. Now, for adults, there are a few methods that we use. Yeah.
But we
Uh,
can't see your
the
face anymore.
Oh,
Yeah.
yeah. I didn't do anything.
Yeah. Don't know what happened. Never mind.
I just continue. Yeah.
Yeah, you continue. Let
I
me
just
just.
continue lah. All right. Now, for adults, we use the principle that is we use degenerative changes of our body, because as adults, because as adults,
Okay.
our body starts to degenerate. Yeah, our bones start to degenerate, and we use that as indicator of age. For instance, we look at the changes that the rib ends show. Yeah, from left to right shows the ribs of a young person, and as he or she progresses through life, finally to end up on the ribs end up as the picture on the uh, extreme right, yeah, full of bony projections, very sharp edges, uh, uh, and things like that, yeah. So these are the changes that you can see in someone who's 18 up until 80, yeah. Next slide,
Azaini,
please. Yeah.
sorry, can you just um start video? You click on your what and start video. Is it possible?
I, I tried that just now. Just yeah. Okay. Okay.
Okay, you're back
All
now.
right. Okay. Yeah. Now is it better now?
Yes, you're
All right.
correct. Yeah.
Okay. So apart from looking at this, the changes uh, on the ribs, yeah, we also look at changes in the what we call the auricular surface. Yeah, the auricular surface is a surface where the sacrum meets the joints with the pelvis. Yeah, that inverted V area there. So again, those changes are indicative of a person's age. They will show changes as you progress from a young to an old person. Same with the symphysis pubis, yeah, the photo on the right, yeah. It's our pubic bone. When you look at it from the medial side, again, it will show changes uh, which can help you determine whether he or she belongs in the early 20s or mid 30s or 40s or 50s or 60s and above, yeah. So uh, these bones undergo changes, and they're quite consistent with time. Yeah, so we use that to our advantage, and with to determine the age of a deceased person. We also look at the cranial sutures. Cranial sutures are sutures which you see on the skull. Yeah, those lines that you see on the skull. Generally the older you are, the sutures tend to close. Yeah, you won't see the clear black lines anymore. Yeah, they will be obliterated. Yeah, so the more lines that are obliterated, the older you are. To put it simply. Yeah, okay. There is a method of doing it, but generally speaking, that's how it's done. Yeah, that's how you look at it. Yeah. Next slide, please. Uh, the whole idea of doing an analysis, anthropological analysis on human remains is try to identify. Yeah, apart from determining the biological profile, we try to use whatever methods, whatever findings that we have to try to determine someone's identity. For instance, the first photo shows the arrow shows bones, but he or she happens to have some instrument implanted. Yeah. Uh, prosthesis that, when he was alive. So sometimes we use that try to determine who this person was, because a medical instrument and medical prosthesis will have a serial number. Yeah, a
Okay.
serial number, and if the presumptive family of the deceased knows where he got his surgery done, we can always trace it back to the hospital, to the surgeon who did it, and in the operative notes there will be that serial number noted down. So we use that. Yeah. So if that serial number is the same as the one in the operative notes, then it's highly likely that it's the person. Yeah. That was admitted and who's now dead. Yeah. Okay. Other things that we can help us identify a person is, if you look at the second photo on the right, you see the sternum, yeah, with a hole in center. It's called a foramen sternale, and it's just something, a variant that you find. It's not fatal, doesn't prolong or shorten someone's life. It's just you can use that if you find that if someone happens to have an X-ray done when it was alive, you can always compare. Oh, that hole has been there for the, you know. So it can help identify. It's not 100% primary identifier, but it does help to sort of narrow down your search. Yeah, Okay, we've got a possible match, yeah, with this person, yeah, because of the appearance of that foramen sonale. And of course, if someone has dental work done, again, yeah, by comparing the skull you're examining, the teeth you are examining, with a previous record when he was still alive, or he may have visited dentist. Dentist might have done certain work on his teeth, and if they match to match what you're looking at, what you're examining, that could be the person. Yeah. Next slide, please. Trauma. Yeah, the first photo, we try to determine the trauma that was inflicted on the body, on the remains, and what caused them. For instance, the first photo shows a typical gunshot wound to the left uh, orbital ridge. Yeah,
Yes.
that's a gunshot wound, yeah, an entry wound. Yeah, and the second photo shows part of the cervical spine. Yeah, the arrow showing an incise wound, a cut, yeah, made by a knife, yeah. Someone was cut, and then the impression was, the sharp force injury is manifested onto the bone itself. Next slide, please. A chart body, yeah, we also determine whether, because it's our job also determine identity of someone who's trapped, died in a fire, whether it's in a car, a building, etc. They're usually unrecognizable, unidentifiable. So our job is try to determine, and of course they're full of fractures, which is caused by the heat rather than anything else. So it's our job to determine whether the fractures that we see are caused by the heat or whether they were inflicted on him while he was alive. Yeah. Second, the photo on the bottom right shows multiple marks of trauma, uh, blunt trauma. Yeah, and in this case, the typical features are roundish, which is typical of a hammer. Yeah. Next slide, please. In someone's older, we can use certain things to determine how old that person is. It may not be accurate, but at least we can tell whether he's 60 years old or above, or younger than 60, for instance. Yeah. The photo on the top left shows the appearance of osteophytes. Yeah, for those who are medically trained, you might know that's bone spurs. Yeah, bone outgrowths, especially on the lower thoracic or upper lumbar vertebral bodies. You can see osteophytic change. Yeah, which is indicative of someone's older. Yeah. Uh, in someone who has had syphilis, which is rare now, but you can see some damage and destruction to the nasal bones, to the palates. Yeah, so yeah, these are typically found in syphilitic patients. Yeah, and of course, heel fractures. Yeah, that can the photo shows two bones, the tibia, where it says joined but not joined very nicely. So you can determine whether someone who has had a fracture before. Yeah. Next slide, please. Different types of spina bifida you can see in sacral bones as well. Yeah. So, but not many. I must say that there are not many diseases that has bony manifestations. Yeah. So many diseases, probably a few only, maybe TB. Yeah. Osteomyelitis might present themselves in bones, but for a lot of other diseases, you don't see that the effects of it on bones. Yeah. Next slide, please. Now, the methods we have been talking about so far are what we call anthroposcopic methods. These are visual methods. Just by looking at the bone, I'm trying to tell you whether these bones are human or not, male, female, yeah, how old they are, whether they are white, black, or Asian. These are just by looking at it visually, yeah. But there is also a method where we measure, yeah, the osteometric method where you use measurements, yeah. The word metric itself implies that some form of measurement is used where we measure certain things, certain landmarks on the bones to try to determine certain traits, yeah. All right, next slide. Uh, Sometimes we do resort to using chemical methods, yeah, and histology is also an important part of our work. Yeah, we look at bones sometimes under a microscope. Yeah, uh, some other methods where we analyze data. Yeah, we use sometimes I'll show you a bit of what we call a decision table and indices. Next slide, please. Uh, to set up an anthropological lab, you don't need much. It's not very expensive. Uh, you need a skull caliper. That's to measure the with 2 points on the skull. You need a skull caliper because of its rounded shape. You need to have a certain type of caliper. Yeah. So you put one end and the other end on the landmarks that you want to measure, and you read off the measurement on that scale. Yeah. A sliding caliper you use to measure uh, other bones, yeah, long bones, yeah, whether it's length or its girth. We use a sliding caliper for that. Next slide. An osteometric board is to measure long bones, femur, tibia, the fibula, humerus, radius, and ulna. Yeah, so you use osteometric board. You put the bone on the board and you push that part of the plank is movable, and you can read off from that ruler, the sliding scale beneath it. Yeah, how long that bone is. Next slide, please. Okay, an example of a decision table is this one. Let's say you're trying to determine whether a bone is old or a prehistoric bone or a fresh bone, someone who died, let's say 5 years ago. Yeah. So you look at the color, you look at the texture, you look at the hydration of the bone, its weight, the condition, it's fragile, whether it's fragile or not, whether there's soft tissue present or not. Yeah. And then you tick off. Yeah. You write down what you see. And for instance, let's say if the bone is contemporary, a recent bone, you will see that it's uh, it's slightly smooth and it's wet. It's very heavy because there's still a lot of grease in it, still a lot of hydration in it. Yeah, and it's very tough. It's not brittle as in old bone. So this helps you determine whether uh, it's a decision table. It helps you determine whether the bone you're looking at is an old bone or a new bone. So you can use this decision table or something similar to it to determine other things as well. For instance, the pelvis just now, male or female, whether they have this trait as opposed to the other traits. Yeah. All right. Next slide.
Okay, when you say old bones, usually how old will they be?
Oh, I would say anything which is interest to the archaeologists, 150 years and older.
I
Yeah,
see. Okay.
because
So it would,
most of the bones that we'll deal with are still, I would say, recent bones. Yeah,
okay.
10, 15 years or even younger. Not younger, but more recent. Yeah. So really old bones are the ones that if they're preserved, uh, they could be, the photo I showed you just now of the bones during the Dutch occupation. Yeah.
Yeah.
Uh, from the 17th century. Yeah. So these are what we call archaeological bones. Yeah. Next slide, please. Indices. Yeah. Sometimes you need to measure whether you want to determine whether a bone belongs to a white skull or is it a black one or an Asian one. You measure its maximum breadth and its maximum length, times by 100, you get a certain figure. Yeah, and then if that figure falls between 70 to 75, you most likely that the skull belongs to a black person. If it's between 75 and 80, it could be a white person, and if it's 80 to 85, the skull belongs to an Asian. Yeah, so these are an example of a metric method of analysis. Yeah, next slide, please.
Oh, there is.
As I mentioned in my first, I'm almost at the end
Yeah.
of my presentation. As I mentioned earlier, a
Sorry, I
lot.
need to change this slide. I'm just worried
All
that,
right, okay,
okay, you
all
can
right.
speak on that slide, but I need to change it.
Yeah, can.
Uh,
Okay. Yeah, but many forensic anthropologists now work in areas where there's, crimes against humanity, a lot of mass graves, and these victims need to be identified. Yeah. Now, there is a research facility in the United States, near the University of Tennessee. Yeah, it's called the Body Farm. Some of you may have heard about it. It's the only facility in the world where people donate their bodies after death. Yeah, they sign an agreement, a contract that says when I die, you can use my body to study taphonomic changes. Yeah. To further the science of forensic anthropology, because forensic anthropology is not just trying to determine uh, the biological profile and cause of death, etc., but it's also a study of the changes a body goes through after death. Yeah. So here, when someone donates his body, these bodies are placed in certain areas. Yeah. Let's say, for instance, under a tree or beside a river or in the boot of a car or in a well or in the place where there are a lot of predators. See, and then every day researchers will come in and take notes. Yeah. See what happens to the body after a week, after 2 weeks, after a few months, after a
I
year. Yeah.
see.
So they look at taphonomic damage, taphonomic changes. Yeah. Uh, Next
Oh,
slide, please. Yeah,
that's very interesting.
it is. It is. Uh, Again, yeah, a good anthropological lab should not just have those instruments which I mentioned just now. It should also have some form of museum or a zoo where we keep examples of non-human bones as well, to compare. Yeah, it would help. If you have a collection of non-human skulls or long bones and things like that. Yeah, to compare. Next slide, please. Uh, Developments in, okay. So far, I've been talking about what we're doing so far. Yeah, uh, the traditional role, the traditional practice of the forensic anthropologist, but uh, the current trends in research is that, especially when we're talking about countries with just starting to learn, I mean, I would say learn, but starting to build their own forensic anthropology service, like Malaysia, for instance. Yeah, we need to have our own data bank. Yeah, uh, we need to have studies done on our population, because most of the database that you have, the comparison tables that you have are from the West, yeah, using Western skeletal material. Westerners are taller, the bones are larger, so you can't actually extrapolate, you can't actually use that to try to determine uh, our population, Asian ones, which we are definitely quite smaller. Yeah, so it's best if we ourselves do research on our population, build our own database, measure our own people, measure our own bones, for us to come up with our own uh, uh, data bank. Yeah, all right. Next slide. Uh, when we're looking also at using nowadays we're talking about AI, yeah, new methods of facial image analysis and more sophisticated techniques rather than just CCTVs and things like that. Yeah, uh, the photo on the left shows the old way of determining how a person looks like by using the mold of a skull and then putting plasticine, yeah, on that. I'm sure you've seen old TV crime dramas where they use that, yeah, facial reconstruction method using clay, and but we've progressed from that. We're not using that anymore. uh, Everything now is computer generated. Yeah, we just feed in the data, how thick the skin is above the eyes, on the forehead, on the cheeks, on the chin, and the computer computes that, and then a image of a person appears. Yeah, so it's
Oh,
gone past the using clay and things like that. All right, next slide, and I believe this is probably my last one. Oh yeah, that's a, I don't know how this got here. Next slide, is there anyone? Is that the last one?
no, that's the last one.
All right, all right. So
Okay,
so
so
that concludes my talk for tonight, for this evening. Yes.
okay, I'll stop sharing first
Hmm.
and then just give me a moment. But I
Hmm.
think that was quite an amazing presentation. You are extremely good at speaking. That's
Thank you very much. It's something I enjoy doing, actually.
yeah, and so much so, I feel like that you can actually have your own um you can have actually have your own show, you know, like
Thank you very much.
something like that what's his name? David Attenborough guy?
Oh yeah, that guy. Yeah,
Oh,
yeah, yeah,
yeah,
yeah.
yeah,
The
yeah.
the the, the naturalist, the nature
The-
person. Yeah,
yeah,
the
that's
BBC.
right. He's
Yeah,
already 100 years old.
he's old. Yeah,
Yes.
he's almost ancient.
So ancient. Okay. I want to know what his bones look like. So I don't, so far, I don't have anyone has any question, but let me just settle this
Yeah.
because I'm going to send off the, okay, this is actually the Google form for the doctors to get their
Mm-hmm.
PD points. And then this is actually for all the nurses and anybody who's interested to get, because I couldn't share it earlier because when I shared, I couldn't go to Google. Okay.
Mm.
So now, if there's no question, I want to ask one question.
Yeah, sure, sure. Fire
How
away.
do you do carbon dating?
Ooh, carbon dating. Now, for now, the only center that does it, at least in Malaysia, I don't do it. I don't do it
Okay.
because first of all, it's expensive and it's not done here locally. The Center for the School of, I can't remember precise, the School of Archaeological Sciences in USM, they do it on their samples, archaeological samples.
I see.
Uh,
So
so
mainly
it's not done for, we
biological
don't do
sample.
that on recent samples like the one I work on a daily
Oh, okay,
basis. Yeah.
okay.
For now, only the School of Archaeological Sciences in USM, they do it on certain samples that they need to determine how old that samples are, those samples are. But not me, because they need, I know they send it overseas and it's quite expensive. So it's not done on a regular basis for criminal cases like the one I work on. No.
Okay, the next question is, how often do you need to go to court just based on the findings of a bones of a dead person?
Uh, for now, well, I go to court mostly on in my role as a forensic pathologist. Yeah.
Oh, I see. So,
That,
okay.
yeah, but
So
I've been
you
called
go to
for from the thing is with bones is that a lot of bones remain undetermined in terms of identity. It's still unknown. Yeah. So when identity remains unknown, the case doesn't go to court
court.
because the bones are still undetermined and in terms of being identity of their identity. So that's why as you compare my cases as going to court as a forensic pathologist, it's
That's right.
far of numbers the one I go as a forensic
Okay.
anthropologist.
So now that you mentioned that, can we bring you back to give a talk as a forensic pathologist?
Pathology, yeah, sure, sure. Yeah, no, no,
So
no problem with that.
I will get another date from you later.
Yeah, okay, no problem with that.
Okay, it's getting late. Thank you very much. I
Thank
really,
you very much for having me.
yes, I think the attendance was surprisingly also a lot. In spite of the fact that most of us are clinicians, but I see a lot of clinicians coming in, and I find it really interesting. So thank you so much. I'll definitely ask you to come back again as a forensic pathologist or anthropologist. I don't know how we will come up with something. And
Thank you, thank you.
thank
The
you so
pleasure was all mine.
yes. Okay, see you guys. I'm going to stop streaming now and stop recording.